Hi, my name is Sophia, and this is my periodontology case study. My patient is Miss N, and she is a 21-year-old Hispanic female, and her chief complaint is a prophylaxis, as she hasn't been to the dentist in a few years. Her social history is that she is currently going to school and working as a waitress to make extra spending money. She states she is constantly busy due to being a full-time college student and working part-time. Though when she does have time off, she enjoys socializing with her friends and attending school events. Her dental history shows that she is missing all 4 wisdom teeth, she has 4 sealants, and 2 composites. She states that she has not been to the dentist in a few years and says she tends to get some anxiety and is a little nervous when she's in the dental office. She lives in an area with an optimal fluoridated water and says that she brushes twice a day and flosses at least once a week. Her diet consists of mainly fast food, 1 meal a day with frequent snacking, as she does live a very busy lifestyle with school and work, but to keep up with her hydration when busy, she says she typically drinks 4 16-ounce water bottles a day. Her medical history shows she is 5'7" and weighs 170 pounds. She states she occasionally experiences acid reflux and does have a family history of diabetes. Her vitals are within the normal limits, being 119/78, and although she presents being mainly healthy, we do categorize her under ASA2 because she is tense and nervous. When doing the patient assessment, we found no significant findings extraorally, but we did find a coated tongue, linea alba on the left buccal mucosa, and cratered tonsils within the intraoral exam. When doing the hard tissue exam, there were 28 teeth total, localized yellow staining on the maxillary anterior linguals. She has a class 1 occlusion with a 2 millimeter midline deviation to the right and presents with 3 caries. Her gingival description is generalized marginal chronic inflammation and generalized rolled gingiva. She does have bulbous gingiva localized on teeth 7 through 10. The consistency is spongy and the texture is non-stippled, inflamed, and endematous. She does have bleeding upon probing spontaneously and generalized throughout the entire mouth. She presents with an initial plaque score of 13%, which is close to the less than 10% goal that we try to shoot for. I haven't seen her for a follow-up appointment to compare the results, but hopefully with the oral hygiene instruction I provided to her, she will be able to maintain the plaque levels on her own. So here you'll see some intraoral photos we took of the right lateral, anterior, and left lateral occlusion. She has a class 1 occlusion, and you can see the 2 millimeter midline deviation to the right. Her gums are a little bit red and inflamed. You can see the rolled gingiva around her molars and premolars, as well as the localized bulbous gingiva along the anterior teeth. Here are some additional photos we took of the maxillary and mandibular anterior linguals. You can see the mandibular linguals that are there. They have trace amounts of calculus within the interproximal areas. And on the maxillary, there is minor yellow to brown stain on the linguals. And you can also see the bulbous gingiva along the margins. She is currently diagnosed as a periodontal case type 1 due to the probing depths and clinical attachment loss, as well as being diagnosed as a calculus type 1. When creating the treatment plan, you must know what the patient is most at risk for to create a plan of action. This patient's risk assessment includes a family history of diabetes. She does brush twice daily but does not floss very often, only once a week. She's semi-motivated but lacks time due to her busy school and work schedule. She eats fast food regularly and snacks frequently, again due to the lack of time. She has 40 bleeding points and 76 34mm pockets. In order to improve her condition, we are going to go ahead and reinforce oral hygiene instruction by telling her to keep brushing twice daily and try to motivate her to start flossing at least once a day at nighttime. We are going to go ahead and tell her to use Listerine antimicrobial mouth rinse with fluoride as an adjunct therapy to remove any excess bacteria received throughout the day. We are going to give her some nutritional counseling, telling her to try to limit the fast food intake and to eat some more whole grains, fruits and vegetables, lean proteins, and dairy products in order to receive the essential nutrients needed to maintain good overall health. We're going to go ahead and hand scale to remove all the calculus and deplaque with a Profi angle. At the end, we are going to apply fluoride varnish to reduce any sensitivity and allow for remineralization of the teeth. We are going to refer her to a dentist to get those cavities taken care of and place her on a 6-month recall to monitor her condition and improve her overall oral health. Miss N's only referral at this time is going to go see her dentist to get the 3 cavities treated and taken care of before they progress into a more severe condition. Miss N has a good prognosis if she receives treatment. If treated, the inflammation should go down and attachment levels should improve back to health. Without treatment, her prognosis is actually pretty poor. She is only semi-motivated and has a busy lifestyle, which may prevent her from being able to return to the office. Without treatment, her caries may progress to an even worse condition and make her more susceptible in developing periodontal disease. These are my references, the TSD Dental Hygiene Clinic, Wilkins, and some images provided from Google. Thank you for listening to my presentation, and you can comment if you have any questions. Thank you.